Up next, we have Ms. Dubi Najeeb. She is going to talk to us about coaching, feedback, and parental involvement, a behavior perspective for a successful intervention. A short thing about her, she's a software engineer by profession, but by passion, she ended up being as an ABA therapist. She holds a BcABA certification to strengthen her community support. It wasn't an easy journey to reskill from software to ABA. She's working with children of determination since 2018, started as an RBT, and recently passed a BcABA certification. Right now, she's working in a center that's operating under a mainstream school environment, completely incorporated with ABA principles. She holds a master's degree in computer application and SENCO Cache level 3. Moreover, she prefers to introduce herself as an autism volunteer since she is guiding many parents and students to achieve their meaningful social life in the community. Let's welcome Ms. Dubi Najeeb. Sorry.
I was a little nervous, but now I feel better seeing all of your faces. Myself, Dubi Najeeb, and I'm working with special needs since 2018. And I found this opportunity. I'm so thankful for Autism Connect to give me the opportunity to speak. So let's start. My topic is like how to coach parents to do the interventions, because we are with special needs children. Our part is also very important. It's not only therapist's job or teacher's job to teach how to do things. No, we are also an important part of their life. So how to coach parents through different steps and feedback, give them positive feedback, and involve them in the interventions and make their life successful. All right. So the main intervention we are using is using ABA principles. So I think many of you know what is meant by ABA. No? What is meant by ABA? It's a science, it's an evidence-based framework. That means a lot of researches are conducted and positive outcomes were evolved, and we can change our students' life using the principles of ABA. Like, for example, if a student don't know how to communicate effectively, we can start teaching them using ABA principles to talk appropriately. All those things we can use, we can teach them using ABA principles. And yeah, it solves socially important problems in socially important settings. So what is your understanding about socially important problems? Socially important problems. Any idea? Socially important problem. For example, I'm a software engineer by profession, so I will give an example. A 6-year-old don't know how to code, like he don't know how to create a program or how to create a game, a computer game. Do you think is that a problem? No. Is that not, that's not a problem. But if he's going out and he wants to, so for example, he wants to pay, and he don't know how to communicate it efficiently, and he is paying openly. So what do we need to do there? We need to teach the child to use toilet or ask for it, and all those things. That is socially important than learning to code something or to solve a 3-digit by 2-digit multiplication. So that is meant by socially important problems. So our aim is to teach the children socially important behaviors in all settings, not only at house, it can be at school, hospital, restaurants. So we are teaching them how to behave properly. Also, it's used in educational field with developmental disabilities, psychological field, and even in big organizations. We can use ABA principles to change our employees' behavior or to make them more productive. And the main emphasis is on increasing good behavior and decreasing bad behavior. So, can you give some examples of good behavior? You don't need to look at the PPT from your mind. Examples. Miss, can I ask for that microphone, the moving one? Yes, that's saying hello, okay. That's a good one. And how about, can I ask? Is it okay that I can move here? Okay.
Thank you. Yeah, that's a reasonably good action in society, is saying hello, whereas I'm not going to say that this is bad, but just for example, for a small child in the age of like older than 5 to remove his outer clothes and be in underwear in the site is like in a it's not such a good, for example, behavior. Yeah.
Can I have it? Thank you. Thank you for your response. So the good behaviors, we can see a lot of appropriate behaviors that children need to do. For example, what's your good name, please? Vanessa. So as she mentioned, greeting others and changing the clothes appropriately, several things children need to do. So we need to teach all of the good behaviors, and we need to reduce the inappropriate behaviors, bad behaviors like shouting, screaming, hitting, biting, kicking and all. How we can do that? We mentioned like we need to change the behaviors. How? Any idea? So ABA focuses changing the environment. If something is restricting a child to exhibit that behavior, so we need to change the environment. For example, if a child wants to eat a lot of chocolates, what should we do? As a parent, what should we do? We will hide it. We will hide it. And we are not given opportunity to say it so that he's not asking and whining for it. Such physical things, environmental things, we change. That is called antecedent. And we are creating an opportunity to do the good behaviors rather than bad behaviors. A few examples are like, we are giving a lot of choices. Not only one option, we provide them with a lot of choices. Behavioral momentum, that means we start with easy things first, then slowly moving to hard part. Then we give prompts. If they don't know anything, we just give him a first step, and they will continue. And errorless learning, we teach them from first step to last step, and reinforcement and time delay. There are a few strategies. As mentioned, we are giving attention to social and physical environment. Antecedent is changing the environment. And consequence. Consequence means how we deal the behavior. Like if a child is having a bad behavior and how we deal it. As a parent, sometimes if a child present here and he is crying, maybe we will say, okay, calm down, I will give you a chocolate. Calm down, or I will give you iPad so that we can watch cartoon. So he will cry so often. That's our consequence we are providing, and the child will do that more. Okay, I cry and I will get it. No need to ask, and I can watch all the time, etc. That is the consequence. That is mean by consequence. And as you all know, for our children, we are providing 20 to 40 hours of ABA training every week. But in Dubai, it's a little expensive, so not every parent can afford. In that scenario, it's very good if we can train the parents so that they can deliver the interventions at home. You agree? Yeah, we can train. Most of the parents are sending the students to ABA centers and providing the services, but there are parents who cannot afford. So they will come to us and we will teach them how to run the programs, so they will support their children directly. That is also helpful, that's also effective. And role of parents and caretakers in the intervention. The thing is here, most parents depends school, IAP, therapists, teachers. Okay, they have a program. They are running it. And every 6 months, they will attend the meetings. Okay, this much things he learned, this much things he couldn't learn. That's it. And the chapter ended there. And they don't follow up. Some parents are following up, but some parents, okay, it's all completely upon the professionals' part. But I don't think that's a good thing to follow. Parents also must involve actively in the process. Also the caretakers, in case parents are working, caretakers will be the, in account, they must do the interventions. So for them, when we introduce ABA, it would be very difficult to understand the terms. The ABA terms are a little complex when we first introduce, so it can be challenging for them. So what should we do? If something is very difficult, what we can do? Something is very difficult, what should we do? We ask for help also. Ask for help. Okay, now we can research, but not every people don't know how to research. Like, even I couldn't know. If I don't know something before, I don't know. Oh, okay, I can Google. My kids are teaching me that. Okay, you Google. Something you don't know, Google. But that's another worst part is even if I teach them, if I give him problem, they will Google and they will quickly get the answers. There's a negative side. We can Google. But I prefer we always give clear, short, simple information for those who are handling the interventions. Clear, succinct information as a guide, reference guide. Many schools are doing here, they are providing some documentations, they don't name it as guide, but I name it as a reference guide with the important informations. And remember, and in between sometime I will ask some questions and those who answer, they can grab a gift. Are you all sleepy? All right. For example, and tell me if you feel this as boring, I will change my way of talking.
Your voice is very soothing.
That's so sweet, and thank you. But yeah, I expected a lot of people, and I'm comfortable that we have very few people so that I can move around and talk. But if you feel it's boring, please let me know. Let me see how can I change my things. So we are coming to an example. Mrs. X had been holding out hope that her son would grow out of his challenging. For example, a child has a challenging behaviors and he is worrying a lot. She's worrying a lot. And after some years, they are getting an intervention. So she is attending the IAP meeting. You all must know what is meant by an IAP, Individualized Education Program, IAP meeting. And the professionals are explaining some terms like, oh, we are going to do that. We are going to do differential reinforcement with the child, and we are going to do token economy, or we are going to do collecting data and all those terms. The school is saying, and parent is like overwhelmed. How can we help her? Did you experience that? Anybody?
Yes, happens a lot.
Yeah, sometimes we behave like, okay, I got everything. Okay, I got everything. But truth is, we didn't get anything. We didn't understand. So how can we help her?
Explain them.
Break it down, explain. In that sense, we can provide a perfect documentation, outlined all the details, and teach them like one by one. This is meant by this, and this is how we do this program. All those things we explain them in their own comfort, like not our big terms, small. I always prefer go to them and in their comfort zone I speak. The examples they might understand, not like big examples. That's the one thing we can do. So the main thing is we are talking about providing a guide. When we have IEP meetings, instead of verbally talking, we provide a guide with necessary information. Anybody among this working as a behavior analyst or working with students in a school setting? You here in Dubai?
No, not here.
Okay, all right. So this would be helpful.
Actually, sorry, I'm from Census Center for Special Needs, and I do have a couple of my staff with me, but I'm sure that they are not participating in this is because they think that their English won't be understood like very well. So,
Even
sorry,
my
I would like
English
to
is
tell them, please, try your best and ask.
truly my first language is not English, and I'm born and brought up in a very rural village in India, and still we don't have a good transportation system in my village. I was so nervous, but I thought it's okay. We are parents.
Just to comfort them to go ahead, please, guys, speak up.
Yeah, sure. You all can share your experience. That would be helpful. That would be really helpful and productive, makes the session productive. So we are talking about the importance of parent guide. And role of parents and caregivers, and the ABA is a research-based science. A lot of researches are conducted, and a lot of good outcomes are evolved. Still, the researchers are going, and what the effect of research? It creates success among students with their programs, and the thing is, the first main thing is Mr. Frank mentioned communication. He also mentioned about effective communication. Effective communication with parents is a critical factor for promoting student success in school. So special education teachers can create a guide to assist with communicating the principles of ABA to parents. And we already mentioned that providing a guide can be an important tool that specifies all the skills needed to implement. And now let's discuss what all are the things we can include in our guide. Is that our personal likes or dislikes? No. What should be in the guide? I didn't change to the next slide, so you can think. It's always good to think.
The first thing could be finding the interest of the child.
In the parent guide?
To know what the strengths are.
In strength, okay, I welcome that. Strength. And I know one face here, Miss Ramya.
And for the parents, it could be the challenge they have. What do we do?
Okay.
How do we go about what is it that I can do?
Okay.
Sorry, can I just make a comment as a parent?
Okay.
I think the first thing that parents need to recognize is, and this is something that you learn as a work in progress or as part of your journey. I think the first thing that parents need to understand and recognize is that in your child's journey, the biggest difference will be encountered and experienced when you step in. Because at the end of the day, no matter how fantastic the system will disappear. That's been my personal experience, and that's been my shared experience over the years with many parents.
Yeah, sometimes truth is hard.
Today, we put in so much time and energy in cribbing and complaining, when that time and energy really can be utilized in focusing on our child and doing what that child needs.
Yes.
Before you even develop the manual and bring the parent into the picture, the first step as a trainer is to explain to the parent that the real visible difference will be seen when you become the missing link or the most integral part of your child's journey.
Yes, I agree.
Work and the communication begins to fall into place. Because most parents will turn around and question and say, but what are we paying the school for? What is the inclusion department doing? Or what is the center doing? Or what is the therapist doing?
Yeah, this training is not directly with the parent. The school will be providing to the parents. School will be the intermediating factor.
To understand why that training is being provided to him or her, I think is the first step to the success of this program.
Success of the program, yes. And as you know, if a child has a challenging behavior, it must be maintained throughout the day, not only the school hours. We have experienced whatever interventions we are doing, it's happening effectively in school timing. But when they reach home or some other place, it will be opposite. It's not being followed. So that's where the importance of communicating with the parents arises. I agree that. That's a good point, but yeah, here some parents are satisfied with school and inclusion and the services, some parents are totally disappointed. It's a hard part, but as parents, we can give 100%, whatever we can.
We work inside this One Health Center, this census center, as this main head for his member. If we see any problem for a student, especially this behavior, we make this meeting for all school holder and also this parents. After we make this more details for this behavior for a student, how about his improve for his developmental or his behavior developmental for a student. We make all details, then mean he bring his parents and guide him. This our plan for dealing for this behavior for your son, and also this step for me and my staff, and inform him what about already this work for all staff inside this plan. But these parents tell this means this trust for all staff or for this 16. This must be you see what's improved, what you can this improve for his son inside your center or school. So if I put this all this plan and also these steps for this parents, who know what we work and we can this mean improve for son inside. I think this time already he can make it cooperate with me. But if no have any plan and what about this order for all stuff inside, he can't make it trust and also no make this cooperate with me.
Yeah, first of all, the plan must be created collaborating the parents. It's not a random plan created by school and later parents being informed. Parents must be involved. As per BcABA, you know, the BcABA board. The BcABA, they always emphasizes parents must be involved in the planning process, and all the professionals must get consent from them before implementing. If parents are not happy with any strategies, no professionals can implement that without their consent. So that's a part where
very important also.
Important. Yeah.
Yeah, and also this, this must be already involved for all his steps for his plan.
Yeah, without a proper plan, nothing is gonna work. If a wrong plan lead the child to wrong direction.
Yeah.
Yeah.
Plus also training for his parents, I think this
yeah, as you know,
make improve.
Yeah, to create a good plan, it takes some time, like a lot of assessments, taking data and all. That's not the topic here, and I'm sorry, I'm moving with this thing, and I will give you a questioning time at the end of the session. And really thankful for you are opened up what you experienced or what is in your mind. Thank you so much.
I explain what exists for my center with ABE inside.
All right, okay. So the importance of parents guide, and we are moving, and the guide should focus on good behaviors first and reducing the bad behaviors. Because we are talking about good and bad means neurotypical children know, they know themselves what is good and what is bad. But special needs children, we need to teach them each and everything, what is good, what is bad, when to do that, when not to do that. That's why we are mentioning good behaviors and bad behaviors all of the time. And the first thing, we must, parent contributions. Yeah, Mr. mentioned that the importance of planning, parents must be involved and they must be invited to the meeting, all the meeting, like whatever the progress or reducing the behavior. You might heard about the BIPs, behavior intervention plans, and individual education plans. So parents must be invited and they must be involved before making one. Before making one, I'm not making any comments. It's an open platform. And reviewing the guide together with the parents during an IP meeting can help ensure that all team members are on the same page and they all knows what is need to be done. For example, a special needs child is not only with a therapist, he must be with a speech therapist, occupational therapist, and a one-to-one teacher. So whatever we do, they must all know and they do the same thing. So it's very important to include all of them in the IP meetings and review the things together. Parents can be provided a guide before, during, or after the meeting. So they have their documentation, they can go through that, they can prepare their questions, and they can ask, they can open up, they can debate, it's okay. They don't need to feel like, okay, my son, if I talk something wrong and that's gonna affecting my son, no, they can, I wish parents must talk and they question if something is wrong. It's okay, perfectly okay. And the critical information must be included in the guide. Yeah. Explanation of ABA. So what is meant by ABA? Because we are doing ABA, so most of the parents must understood what is ABA. So something that helps them to understand, simply define. And the definition of basic ABA principles, like we are using a lot of principles. So whatever the principle using with the student, we must include in that guide. For example, not all the principles. So briefly explain what is that. For example, reinforcement. You might all heard about reinforcement. Yeah? What is reinforcement?
You give a child something to have a positive behavior. You take some behavior away, and you keep repeating that.
Yeah, we are increasing a good behavior. Like we give rewards, and for example, in our case, we work hard and we meet our targets. So if our boss give like something extra every month, what should we do? We will work for it. We need to, okay, I'm getting more, so I will work hard to get it more every month. Something like that. So if we give a child a praise or something he likes, he's gonna do that more than in future. That is called reinforcement. For example, say some students doesn't like to clean up when they have a transition, like from playtime to class time, so they don't want to give their toys. So if a teacher is giving a sticker or a praise whenever a child tidy up the toys, then in future he's going to do that more because he likes sticker and praise. But if he doesn't like a praise or a sticker, he is not going to do it. So we must analyze a student before, what he likes that you mentioned and what he doesn't like, and we must plan. Everything we are going to teach a child, because they are not learning from observation or looking here and there. We need to teach from one by one. So we must understand what are the terms and how to do it. So first, the definition of ABA. Next, the principles of ABA we are using in our intervention. Next is the summary of behavior. Obviously, our students have some challenging behaviors. Most students I have come across have challenging behaviors, but some are very quiet. But even though we can create a behavior intervention plan and its functions. So what is a behavior intervention plan? How many of you know about behavior intervention plan? Yeah. Any chance to talk about a little? What is a behavior intervention plan?
Good morning.
Morning.
It's when you decide to work on a specific behaviour and have a plan in place to work in that you share with everybody involved.
Yeah, if we want to focus on a specific thing, we will set up what to do, how to do, all those things. That's a behavior intervention plans and functions. Functions, what is a function that I will discuss after this? When and where and how long services will be delivered, all those things must be included in the guide. Yeah, what is in the BAP? ABC data that you almost heard about it before. A stands for antecedent. That means what happens before the behavior. And behavior is what the child is doing, and consequence what we are providing. That must be introduced, that must be included in the BAPs. For that, ABC data we need to take for minimum 3 to 5 days so that we can see why the child is doing that behavior, inappropriate behavior, so that we can create a BIP depending on that function. And you might also know about what are the different functions of behavior. A child is doing some behaviors mainly for 4 things.
Sorry, could you say that again? 3 to 5 days for what?
Taking data, like ABC data. Some parents are taking data when they see something inappropriate at house, and they will communicate with us. Okay, my child is doing this new thing, and I'm taking data this much time or this much minutes or seconds, all those things that really helping how to make a behavior intervention plan. For in a school setting, teachers might collect data by recording what happens in a child's environment, like why the behavior is occurring and how to deal it, all those things. It's the teacher's job. She will observe and she will take data, take note. Sometimes it may not be in a proper data form, at least a note. Okay, this student did this at this time. Teachers are noting it down, and they will communicate with the SEN or inclusion team so that it will help to identify why the child is doing that behavior. That must be included in the parent guide. So first thing is behavior definition, second thing is behavior principle we are using, and the third thing is BIP, and what is the BIP for, and how it is gonna work, and what is that solving at the end. And the fourth one is the ABA interventions. For example, we are creating a BIP for, we can see that in ADHD students, they cannot keep time. If they are playing, they keep going with gaming. In that scenario, a timer would help. At the beginning, maybe it won't be helping. We must assist the child to follow the timer, stop the gaming, and start working after the timer rings. All those things we must teach them. So that is the intervention in the case of a child is out of work or not transitioning properly after the gaming time. So whatever intervention we are using, that we must describe in the guide or the documentation, and that must be included in the documentation. Self-graphing. All the children can do that. Self-graphing means if they cannot stay on task. So we can motivate the child. Okay, you note down how many minutes you are working. 5 minutes. Maybe initially if he is working for 5 minutes, that's great. 5 minutes is better than 0. Okay, you get this time, a reward, whatever he likes. The next day maybe he can, okay, I worked 10 minutes today. Increase the time. Okay, next time 15 minutes. And we teach the child to self-monitor. Okay, today I worked, and we provide them a data sheets. We teach them how to note it down. Okay, on Monday I worked 5 minutes. Tuesday I worked 10 minutes. Wednesday I worked 15 minutes, and it keep on increasing, and that motivate the child to work more. And after some point of time, he don't need a reward. The pleasure of finishing the task itself would be a reward for him. That's not an easy process. It may take months or years to achieve that, but that strategy is a good one. So whatever strategy we are using, that must be described in the parent guide. And we must tell them, or we must inform them, this is what we are doing with our child, or with your child, with our student, and this is how we can model them, we can show them how we are doing and all. That must be done during the meetings. Yeah, some of the common behavioral interventions, token economy. In schools and centers, we are doing that a lot, tokens. Boring? Is it feeling boring? You need any dancing or something? 2 minutes, 3 minutes. Some motivation sessions, we have that when they feel boring, put something, and it's okay to dance. And that helps us relax and helps to focus. Anybody? No? Okay. Or as a punishment also, I can give dancing. Tokens. Students in school setting, we are using token economy a lot. That means if they finish a specific number of tasks, we give tokens like, okay, I did 1 question, 1 token, 2 question, 2 token, and 5 tokens, okay, you can go and play like that. That's the system works. And differential reinforcement is we are praising a child or rewarding a child when he is doing a good thing rather than a bad thing, like inappropriate thing. For example, when we see a child sitting, okay, you are sitting, I like the way you sit. But when he is running around, okay, we don't give attention. That's a differential reinforcement. And self-monitoring, with all the children, they can do the self-monitoring. Even we are doing the self-monitoring. Sorry, which one? Yeah, when the child is doing good behavior, we praise them. For example, our target is making a child sitting. That is our target. In that sense, when we see a child sitting, always we praise them. Praise them in a very high tone, like, oh, I like the way you are sitting, you are very good, awesome, and the child must feel the energy. But whenever he is not sitting during the task time, we don't need to give anything. Ignoring. We have differential reinforcements also in the different types. It depends on the type we are using. And self-monitoring. I like the strategy of self-monitoring. We all need sometimes when we are gaining weight, we need to monitor our diet. And when we are using our phone so often during weekends, we used to monitor, or we need to make some self-strategies to make our time productive. It's not only limited with special needs students or people. We need also in this time. It's very hard with this technology. It's taking our hours, yeah? You all agree. And self-graphing, the same thing. It's a different, they're graphs, and those who are visual learners or visual motivators, when they see the graph going up, that will motivate.
Can you give us more example about self-monitoring? How to teach the child self-monitoring?
That depends on the case. Depends on the case and based on the analysis, assessment and all. This is a basic term. Case to case is different. For example, I worked with a child, he's talking a lot. He's not talking, he's calling out teacher. Teacher, 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 maybe 20 times, 22 times in a lesson. So we gave him a counter, like 5 counters. Okay, you have 5 chances to call your teacher. Whenever he calls the teacher, okay, every time we will take out 1 counter. Initially, we do that. Later, he is okay, he will give the counter. Whenever he calls teacher, okay, 1 counter because I call 1 time. Then when it's no counters, his chances are done. That's one way we used. So it depends on the child.
It's working with normal kids, I think. But for special needs kids, we have like that. Some kids speak a lot. And teacher, they want something, but I think it's not working if they are special needs. We need to use another strategy with them.
Yeah.
Yeah, I think sometimes we need to ignore them. Otherwise, they stop to talk too much.
Yeah.
And then, otherwise, we support them in other good behavior. Because I have 1 child in my classroom. Yeah. I think he's 5 years old. He keep talking. I used to replay him. Okay, what you want? He increase what he want. Then after that, I ignore him. Now it's working.
It's working, yeah, because otherwise he's not gonna do anything. He's always calling out teacher and asking unnecessary questions. It's not relevant. Maybe something, whatever he had last year. That will be the thing, okay? And the 5th thing is information about the types of data collected. Like, every day to increase or decrease behaviors, we need to collect some data. Some examples of data are frequency. For example, if a child has a hitting behavior, we need to count how many times he hits a day or hits an hour. Duration, amount of time a behavior occurs. For example, if a child don't have a sitting tolerance, we will measure the time, record the time, how long he can sit on chair. and rate number of times a behavior occurs per minute or hour. That's what, like per minute, how many words he can write or something like that. It depends on the case and depends on the requirement. And trials to criterion, the number of learning session until the student masters the skill. That means if we are teaching a child to do the addition, we keep on counting how many classes required exactly to teach that skill, how to add to one-digit numbers. That are some of the data being collected. And we evaluate, like how it is going. Without data, it's very hard to work with ABA. Yeah, and the last thing is we provide a graph. Most parents might have seen that in the IEPs with the graph. Where are their students before the intervention and what happened after the intervention? Yeah, before the interventions, mostly the behaviors must be in a 0 or very less, and when we start the intervention, it would be increasing. If it is a good behavior and if it is a bad behavior, it must be decreasing. Depends on the requirement. May I know the time? 10:44, okay. Thank you. And now we've talked about the importance of a guide or providing some information regarding the interventions, like how to support parents, how to help parents. That means give everything as a written document, and during IEP meetings explain one by one, like what is ABA, what are the things we are doing with the child, what are the data we are collecting, and how it works with a graph, a visual representation. And yeah, this much things we included in the parent guide, and it's the job of professionals to explain the parent until they must understand clearly. There is nothing, it must be transparent. They must openly, I didn't understand, I'm not getting it, till they get it. It's okay. How many sessions it takes, it doesn't matter. But if a parent knows it, it's very good to know. For example, if you are using a token economy in school, and in academics, sometimes the school timing is not enough to teach the skill. Yeah, teachers do 1 hour of math or 2 hours of math. We teach a skill like adding numbers or finding an even number. But what if after reaching home, taking a break, and parents start teaching them? Using the same principles we are using in the school, it won't be an overwhelming for the child. Initially, maybe he won't follow because it's his comfort zone, his house, his play area, but later he will follow it because the same thing school is doing and parents are doing in the same way. It would be easy for a child to follow it. I prefer, sometimes I think, okay, he is doing a lot of learning at school, at house, let him play. But sometimes I feel most of the kids are spending their time in on devices, watching cartoons and all. So better to learn something than watching cartoon. Maybe one question or one thing they learn, and watching a cartoon is more productive than spending hours on iPad or tabs. Not all, but some are like that. Even not only the special kids, even neurotypical children, when they reach home, the first thing they do is take the tab and start watching something. Even we, after work, when we go home, what we do first? What we take? Phone. And checking and reels. Now it's reels and shorts time. And 20 seconds, it goes like 20 hours. We don't mind if we don't eat or shower or something. It's like that. So it's very important to have an idea of what we are doing or what as a parents we need to do. And how can we coach parents? Like, for example, if we need to, I will give another example. A child has a screaming behavior to get something. For example, if a child wants some cookie or something he needs, he will scream. Instead of asking or pointing or a picture, whatever communication system he is using, he is screaming for it. At school, they are redirecting the child. Okay, ask nicely, ask politely. And he's asking cookie, cookie, and I'm giving the cookie. But the house child screams, okay, okay, I know you want cookie, I will give. So what do you think? Will it progress for a longer term? Because one thing at school and another thing at house. Yeah, some kids are smart. At school, they will ask. At house, they will still continuing the screaming, and they will get whatever they want. So in that case, it's very important to coach the parents how to do the things at house also. That's what the BST helping. BST means behavior skill training for parents or caregivers. Even caregivers, most of the time now, kids are spending time with nannies because parents are busy with work. So we can teach the caregivers or nannies how to implement some things that will be helping a child, that will be helping in child's life. And behavior skill training, and it can be, the role of a parent can be some skills, whatever their child is doing at the center, they will run at the house also. For example, if you are teaching a child to label day-to-day items, we are teaching at the center, and if we teach or revise it at house, that would be really helpful. So that's called generalization of skills. But sometimes some kids are not getting anything from outside service centers, so parents will be the primary service providers. So it depends on the requirement, we need to coach the parents. As parents don't need to learn about the instructional things like teachers do, but they need to learn basic things to run few targets, how to deliver instructions. Why we are coaching the parents?
They spend the most time.
It can be. What was the most? We need to coach the deal with the child to increase the compliance. Because if their therapists are doing one way and parents are doing another way, the child will be running away. He don't want to do it. He don't want to follow. So to maximize compliance with instruction and minimizing the challenging behavior, it's very important to coach the parents or caregivers. So as a professional's role, it's very important to identify, prioritize, and foundational skills needed for parents. Some parents, in centers, we need to give firm, clear instructions to make them work. But as a parent, we are so lovely and we are so pampering. When we are teaching a child, we are teaching his name, answering the personal questions. What's your name? We are teaching a child. What's your name? And he is running away. Okay, you don't want to learn now? You go and play. And after 5 minutes, we again, okay, let's learn. What's your name? And he is running away. Okay, still you want to play? Okay, you go. Is that works? No. So in that situation, we need to teach a parent to be firm, to clear instruction, to make him come to the instructional table or wherever they are learning. Make a firm, clear instruction. They must lead their child, and they must teach the targets. Maybe.
Sorry, but do you think working parents, like parents who work from 3:30 or 4, do have that patience to deal with that child as the caregiver or the teacher or the therapist?
That's what the coaching helps.
So do you think it will teach them how to be more patient?
Yes, it will. Parents need to get coached, they need to get trained, maybe number of sessions, they can. If they can, that would be amazing because they can support their child throughout the day and the child will progress fastly. That's what I observed. Because some parents, they are willing to learn, they are not tiring after the work, they are so enthusiastic, they are so eager, so they will come and we coach them, and they will implement, and the child is progressing quicker. I observed that personally, so I believe in that system. But I'm not insisting that all parents must work, it depends on their situation. So we talked about the importance of coaching parents and the 4 Ps. When parents are teaching their students or their children, the things they need to keep in their mind. That means 4 Ps. The one is prior to the instruction. That means before we start teaching, what should we do? That is called prior to the instruction. We need to set the environment, like remove the toys from the area, turn off the TV or distractions, all the distractions we remove and create a good environment so that child comes and he can focus. Initially, it won't happen, but throughout the training, the child, first we need to train the parents how to do it, then they can do with their children.
Do you think there is a way for like coaching siblings on how to?
Yes, we can do that with siblings also. It's not about parents. We can teach siblings who are willing to do that. Not all siblings, but if they are doing, that gives amazing progress, beliefs.
Very like it's too much pressure for the other siblings when they have an autistic child, you know, especially when they're like not much older than they are. So it's very hard for them to deal and adjust and like accept that he's an autistic child and he has to be a bit different than they are. The attention that he gets is different than the attention that you get. So
Yeah, we can teach the siblings also. Then we can train them so that child can manage in all situations because all are supporting. So he won't be in he won't be in an overwhelming situation. It will help. So we need to arrange the instruction area and presenting the instruction. Like what are the things we need to check? Look the child in the eyes, remain quiet and calm, and present clear instructions. We are angry and we are going to teach a child. Do you think it will work? No. We have to be calm first and we need to set for everything, our materials and resources ready, and we need to tell the child, okay, we are going to learn. When he is playing, okay, come on, learn. Is that works? No. We need to tell them before, okay, after 5 minutes or 10 minutes, time, yeah, to settle. They are not like us. Even I don't like, if I'm doing something and my husband calls, okay, do this. No, I don't like. I need some time to prepare. So our children also need more time than ours. And start the teaching with proper eye contact and calm and clear instructions. Always give short, clear instructions. Like, for example, if you are teaching a child to do the maths problem, okay, add numbers or something like that. But every time that must be the same. One time we say add, and next time solve the problem, and next time, okay, do this, or doesn't work. Always be consistent with our instructions. And prompting. Sometimes they need, if some children have processing delay, so they need a startup. So we prompt the child to start with correct responding and keeping things positive. Whenever they do something good, praise more. And even if they are doing in a wrong way, make it as a positive comment and teach them to do it correctly and create choices. Always start from easy ones and go to the hardest part. And prerequisite skills. So practitioners must evaluate the baseline skills of parents, what they can do. That's a practitioner's job, and practitioners must coach parents based on the assessment results. It can be based on the needs also. For example, if a child is homeschooling, he's always at house with his parents. So all the main job is done by the parent. So parents must be getting a lot of training so that they can support their child. For example, if a child is going to school, so they are not the primary agents, they are just supporting whatever the school is doing. So depending on the requirement, we need to coach and train the parents. We need to teach them how to settle a child, how to teach the skill. For example, if a parent don't know how to multiply 2 digit by 2 digit, she cannot or he cannot teach the child. So they must learn it first, then we will teach. We can see that most of the autism kids are very good in math. They can solve 5 digit by 5 digit addition in their mind. Even I cannot do that. I always need calculator or pen and paper to solve. But my students do that. Okay, I give 2 problems and they write the answer. So we need to improve our skills so that we need to make sure they are doing it correct. And the behavioral skill training. First, there are 4 steps in the behavioral skill training. The first one is giving instructions, then modeling time. Yeah, giving instructions can you give one example that you need to be learned? Give one example that you want to learn for your child.
What I would want to learn?
Yeah. Anyone? You?
Patience.
Patience.
Patience. Like it's very hard. Like especially when you're like. That's why I'm not a mother of an autistic child.
Okay.
I don't deal directly, but because observing teachers in class, it can be very stressing. So patience is the most important thing, because if you don't have patience and tolerance, you cannot deal with them.
That's a basic thing we need to have, patience and tolerance. So you can get that training for that. You can get the training. So when you raised your requirement, so if I'm a professional and you raised your requirement that I want to practice with my patients, so I create a program, like how I can support you. It's not, I will arrange a meeting with you and talk, have an open discussion, and I create some program and I have some written instruction. And I model. The next step is I model. I will show you how to do that. And the third step is rehearsal, and you will do it to me. And we both working like a role play. And the last one is praise or corrective feedback. So I will help you to correct when you are doing any mistake. And if you are doing it great, I will give you praise and all. Likewise, the process goes till you master the skill. After that, you can transfer the skill to your child or your students. That's how the behavioral skill training works. See, we need to look at the goals of training parents to focus on observable and measurable behavior, and we need to focus on the ABA principles, and we need to monitor, and all those things. So it's all incorporated with ABA also. When we are with our special needs children, ABA is the most effective strategy. They are giving a lot of meaning in their life when they are getting throughout their early life. Even the late intervention works, but the progress would be a little later. Okay, all right, it's all almost done. Yeah, we did our BST steps, and yeah, if you cannot meet the presenter throughout, you can create videos how you do, and the presenter will give you the corrective feedbacks. And I have one question. Anybody can tell the 6 steps of parent guide? Nobody. All right, it's fine. Thank you so much for being with me, and thank you so much for Miss Dolly and Miss Hiral. Thank you so much. Thank you.
Hello, everyone. It's really nice to be here, and we're going to have Dr. Temple with us live right now. Dr. Temple does not need an introduction. Can you tell I'm one of the biggest fans here? But Dr. Richard will introduce her.
No, it's my great pleasure and privilege to introduce Dr. Temple Grandin. Dr. Grandin is an American academician, animal behaviorist, and internationally renowned spokesperson for autism spectrum disorder. Dr. Grandin is one of the first autistic people to demonstrate the insights that she has gained from her personal experience of autism. She is currently a faculty member with Animal Sciences in the College of Agricultural Sciences at Colorado State University. Based on her experience, Grandin advocates early intervention to address autism and support teachers and professionals who can redirect children and adults in fruitful decisions and directions. She has been an outspoken proponent of animal rights and the neurodiversity movements. In 2010, Temple Grandin was listed as one of the 10 most influential people in the world by Time 100, which named her in the Heroes category. In 2011, she received a double Helix Medal and has received many honorary degrees from many universities, including McGill, Swedish University of Agricultural Sciences, Carnegie Mellon, etc. Grandin has been featured on many media programs. She was the subject of an Emmy and Golden Globe-winning biographical film, Temple Grandin. In 2018, Grandin was featured in the documentary This Business of Autism, which explored autism employment and the success of autism employers. She has been written up in Time, People magazine, Discover, Forbes, and the New York Times. She is best known for designing the Hug Machine, which is a deep pressure gadget planned to calm extremely sensitive people, which are ordinary people with autism. And I know her personally, working with her as a colleague to sequence her entire genome, to read the chromosomes from end to end and make sense of that as to how they caused her condition and how they continue to influence her life. And I'll never forget working with her to do that. And if you're interested in what we found out, come to my lecture tomorrow at 11 something. So introduce Dr. Grandin.
Well, it's good to be here. And also a lot of emphasis on skills like getting dressed, combing your hair, brushing your teeth, eating with utensils. Well, one little tip with these kids, you have to give them time to respond. They're like a phone that's only got one bar of service. And slow down when you talk to them. And when the grown-ups talked fast, it went to gibberish. Can you put the next slide up, please? Now, the thing about autism is it goes all the way from Einstein, who had no speech until age 3, to somebody who has much more severe autism when they become nonverbal. But some of the ones that are nonverbal can learn to type independently. But a brain can be more social emotional, or a brain can be more interested in what they do. And having an interesting career has been very important to me. I'm really happy that I'm a professor. I've got graduate students and I've done a lot of research in animal behavior. I have 3 graduate students that have become university professors. I'm very, very happy about that. So a brain can be more social emotional, or a brain can be more interested sort of in what they do. This is why I think it's important to get kids out doing interesting things. Some of these kids that get addicted to video games, one of the ways to get them off the video games is have them fix motorcycles, have them fix cars. It's the one thing that's worked. They find out that maybe fixing those motorcycles is much more interesting than the video games. And that's something that can turn into a career. And it's a skill that other people want. Let's go to the next slide. Shows a picture of Thomas Edison. He would probably be autistic today. He dropped out of school. Now, fortunately, he had a mentor. And he had a mentor that taught him how to use the telegraph. It's really important for students to get exposed to things. I was not originally in the cattle industry. I got exposed to it as a teenager. And I had very good teachers and mentors, starting with my mother when I was very young. She was always pushing me to do new things. She encouraged my ability in art. I had a wonderful primary school teacher. I had a wonderful science teacher who got me interested in studying with all kinds of interesting projects to do. Good teachers are so important. Let's go to the next slide. There's Einstein. He would probably be in an autism program today. Let's go to the next slide. Put the next slide up, please. Now, I'm a kind of a NASA fan. And I got 5 years ago, I got a chance to go visit visit this launch pad. This was like so much fun. And what I learned when I went there is the astronauts, they had we call it the right stuff, but they were people that had Tourette's syndrome, that were dyslexia. They were building the launch pad. They were designing control rooms. There were people there at NASA, really smart people that were, some of them probably were on the autism spectrum. I've been to many, many NASA sites. And if you look at the old videos of going to the moon, look at the people in that control room. I think there was quite a few autistic people there. And they were really happy that they got to be involved in that project. Let's go to the next slide. Now I've got emotions, but I get emotional over interesting stuff I do. And Voyager spacecraft now is 45 years old. The scientists are in their 80s now. They are still tracking it. They've managed to keep it going. For a long time, they had to work out of a storefront next to a McDonald's, but they kept it operating with no funds. And I can get really into that because it's so cool what they're doing. They're still learning from this spacecraft that's 45 years old. Let's go to the next slide. Yeah, past Saturn, we can go to the next slide. And then you've got the techies down there that keep that antenna going. Yeah, they probably have to do it at 3 o'clock in the morning. I got a chance to sit at the original mission control desk. That was really, really cool. Go to the next slide. Now, let's not get hung up on the labels. Autism is this big spectrum. And the problem with autism is they keep changing the diagnosis. Originally, maybe 30 years ago or so, you had to have speech delay to be labeled autistic. And then they added Asperger's syndrome, where you could be socially awkward with no speech delay. And then in 2013, they merged everything together. And you've got a spectrum that's going from Einstein to somebody that may have much more severe problems. But I can't emphasize enough on working with the little kids, because when I was 3, I looked very, very severe. And we can go to the next slide. I have grandparents that come up to me all the time, and they find out they're autistic when the kids get diagnosed. That just happens all the time. And sometimes adults later in life getting diagnosed helps them with their relationships. But I'm concerned that too many fully verbal, smart kids on the spectrum get so hung up on the label, the parents get hung up on the label, that the kid's not learning basic skills like shopping, learning how to save money, doing laundry, just very, very basic things. Another big problem I'm seeing is not making the transition into the world of work. Work skills are not the same skills as academic skills. We need to start children when they're 11 years old, maybe volunteering at a fruit stand or something like that, where they learn how to work for somebody outside the family on a schedule. Let's go to the next slide. And that's me having a real fun time at the vehicle assembly building. We'll show another slide. All the cool stuff I got to go do there, like go up on the roof and I wasn't supposed to. That was really cool. All right, let's just get back to the getting important stuff in autism. Let's talk about some basic issues here. Sudden surprises scare. Okay, let's say a child's going to go to a new school. We'll try to visit it maybe before they go there, or look at the website. The other thing that's difficult for a lot of individuals with autism is multitasking, when you rapidly have to multitask. But we've got to get these kids out doing stuff. We've just got to do that. And I was brought up in the 50s, and we used a method, I call it teachable moments. So let's say I took my drink right here, and I stirred it with my finger. That's bad table manners. Now, my mother, instead of saying no, she would say, use the spoon. People think it's disgusting when you put your finger in the cup. She would give the instruction instead of saying no. That was my generation, a method of teaching social skills. And social skills were taught in a much more structured manner than they are today. We need to limit the screen time, the phones and the computers, to about an hour a day. And we need to get kids out doing things. Today, I saw some kids out playing in the playground that's near my house, and that's the kind of stuff that kids should be doing. Let's go to the next slide. So there's the teacher there working with a really young kid. And the thing I have found on very young children's programs, some teachers just have the ability to work with these little kids. Now, if you've got a little kid that's not talking, the worst thing you can do is let them just sit and play with a phone all day. That's the worst thing you can do. You need to get an effective teacher working with them. And I find some teachers have the ability and some don't. Let's go to the next slide. Teaching turn taking. That was done with me with board games. You have to learn how to wait. It's something that's very important for young autistic children to learn how to wait. And we'll go on to the next slide. Teachable moments. We already talked about that. You don't yell and say, stop it. You give the instruction and the reason why. Let's go to the next slide. You need to limit the video games. One of the things that I was not allowed to do when I was in high school was just become a recluse in my room. I was not a good student. I was a terrible student, but I still had to attend to classes. You know, too many of these kids are just getting on the electronics and just staying in their room, playing video games all day, and they're not getting wonderful jobs in the video game industry. And if they were getting wonderful jobs in the video game industry, I'd be a lot more positive about it. But some young adults, again, addicted to video games, the one thing that was successful in getting them off of it was working on motors and engines. And they found out that they were more interesting than the video games. Let's go to the next slide. Now, my mother would always stretch me to do new things, but she always gave me a choice. You know, we could go to this store or that store, or you could do this activity or some other activity. Always giving choices. You can do your homework when you get home from school, or you can do your homework after dinner. Giving some choices. And one of the things that helped me, being raised in the 50s, is we had sit-down dinners. And, you know, my sister and my parents would take turns telling about their day. Unfortunately, in some families, that's not happening. And this was part of getting me to be a lot more social. And you can learn business social. Another thing that was done in my family is when we were 7 or 8 years old, and it was done with most of the families in my generation, is when I was a little kid, I had to dress up in my good clothes when the parents had a party, and I had to serve the snacks. I had to shake hands with them, learn how to talk to them. Really, really good social training. Let's go to the next slide. Let's talk about sensory issues. Sensory issues are really real. And loud sounds like a school bell or a hair dryer or maybe a vacuum cleaner would hurt my ears. Now, one of the ways to help a child to tolerate these sounds is to let the child play with the vacuum cleaner, where they turn it on. They turn the hair dryer on. And when the child turns the dreaded noisy thing on, they often get to where they can tolerate it better because they are controlling it. Now, there's some kids wearing headphones all the time. And the problem is, if you wear headphones all the time, and that's on the next slide, the sound sensitivity may get worse. So what you want to do is have them with you. You can have them in your backpack. So they're with you. They give you control. You've got them with you. But then you try not to wear them. Because I've heard stories where they were wearing headphones all the time and the child got so sensitive, he couldn't tolerate quiet conversation at the dining room table. But sensory problems really are real. Sensory integration methods can be helpful. There's a paper you can look up online. It's called Environmental Enrichment is an Effective Treatment for Autism. And it's a method where you stimulate 2 senses at the same time. Maybe touch a warm coffee cup and then smell some aromatherapy. So you're stimulating 2 senses at the same time. And the title of the paper is Environmental Enrichment, an Effective Treatment for Autism. Now, let's say we have a nonverbal older child or adult and problems with maybe destructive behavior or hitting. The first thing with somebody who cannot speak is give them a way to communicate. Not being able to communicate is totally frustrating. Also, you have to rule out, do they have a painful medical problem that they can't tell you about? That's the first thing you need to make sure they don't have acid reflux. I had acid reflux last night because I ate some hot sauce I wish I hadn't eaten. And my stomach was hurting last night. But the sensory overload, if they have a meltdown or outburst in a busy, noisy store, that is probably sensory overload. But we've also got to give them a way to communicate. That is just super, super important. There's a next slide just shows that sensory symptoms are part of the neurobiology of autism. Now, when I was a little kid, they tested me for two things, deafness and epilepsy. Now, I could pass the deafness test, but the problem is my ability to hear auditory details impaired. Like if the grown-ups talk fast, it was when adults talked fast, it's like, that's what it sounded like. Because I didn't hear the hard consonant sounds. Like if someone said the word cat and they said it fast, I would hear ah. So my speech teacher would say cat ta, or she'd hold up a cup and she'd say cup pa, and she switched back and forth between saying cup and cup pa. Because if people talked fast, then all I heard were the vowel sounds. Stretch out and enunciate the consonants, and sometimes hearing would kind of cut in and out like a bad mobile phone connection. There's kind of three ways that the brain can have a problem with language. Not hearing the auditory detail, where I'm hearing gibberish, trouble with getting my speech out, expressive. And then the next slide, I talk about echolalic children. And echolalic children, they have good speech and they will recite an entire movie script. But the problem is they don't know what the movie script means. That's the problem. So in Life Animated, what these parents did is this child had memorized Disney movie, and they picked out phrases in the movie that could be used in real life. And then their son started to figure out that words had meaning. So an echolalic kid, you've got to teach them that all this language they're yakking out has meaning. So there's kind of three ways the brain can be messed up. The next slide talks about attention shifting slowness. Now, if I was a computer, I've got a very, very small, I'm an Intel 286. I mean, if you're a computer geek, that's the first chip. But I have huge memory. Attention shifting slowness. This is why you have to give the child time to respond. The next slide shows attention shifting slowness. It's an old Ami Klin slide, and look at how the normal person's looking at the eyes. But the other more important thing in this slide is look at how many times the normal person looked back and forth compared to the autistic person who's trying to lip read. Tension shifting slowness. All right, now let's look at things where this could cause a problem at work. I want to see these kids get employed, and I want to avoid the jobs such as rapid multitasking at a McDonald's takeout window. That would be a very bad job. Another problem is I don't have any working memory. So if let's say I have to shut down the cash register at night at a store, and then maybe 5 or 6 steps, I need to write them down. I need to write the steps down like a pilot's checklist. Long yakety-yak strings of verbal information do not work with me. Let me make a pilot's checklist. Okay, and if you don't want to disclose autism, just say to your employer, pilots need a checklist. I need one too. And for pilots, it's mandatory. In every country in the world, pilots have to use checklists. Now, I'm talking about giving the child time to respond. When I was 5 years old in school, we had a little assignment where we had to name the pictures that began with B as in beautiful. So I called the suitcase a bag, and the teacher marked it wrong. And she didn't give me time to explain that in our house there weren't suitcases, they were bags. And that was very, very frustrating for me. In the next slide, we're going to be talking about some visual problems. I don't have visual processing problems, but some individuals do. And vision might break up similar to a migraine headache. Or this next slide that shows an image that's breaking up. Seeing probably wouldn't be a primary sense if that's the way things look like. And this may explain why a number of people that do not speak touch and smell things, because those senses provide accurate information. And we'll go on to the next slide that shows an escalator. Now, in your brain, you have the eyes that work like a camera, but then in the back of the brain, there's circuits that assemble the graphics file for shape, color, motion, and texture. And if there's something wrong with those circuits, print may jiggle on the page when you try to read. These kids are often terrified of escalators because they can't tell how to get on and off of it. So you have a child that hates an escalator. The chances are he has a visual processing problem. And the eye exam may be more or less normal. And if you have a child that can't read, the next slide shows print jiggling on the paper. Try different pale colored papers. Now, this is my children's project book right here. Well, you see the light blue paper color right there. Try printing on the homework and the reading materials on maybe light tan paper, light gray paper, all these different colored papers. That sometimes really works for some types of dyslexia. Just try different colored paper, try different colored backgrounds on your computer, on your laptop, or on the iPad. The next slide, I talk about lighting issues. And one of the big ones now is LED lights that flicker. And one of the ways that you can determine if LED lights are bad is take pictures of them in slow motion. So you want to wave like this, because when you play it back, you want to make sure it's playing back in slow motion. And you're going to find some flat screen TVs that flicker. Now, tablets do not flicker. Most laptops do not flicker. But there's going to be some flat screen TV computer monitors that are bad. And this does not affect all people with autism. But I'm going to say about 10 or 20% may have a problem with seeing flicker of LED lights or on TVs and computer monitors. So what do you do if you have that problem? You go buy a lamp and you find an LED light that does not flicker and you put it next to the desk. And you can buy cheap ones that don't flicker. But this is something that's a real problem. And when I get asked about designing a school or a home for people with autism, I want to make sure we have LED lights that do not flicker. I just learned from a technical specialist that if a TV flickers, it has to do with the internet connection. But this kind of stuff needs to be fixed, and you can just test it with slow motion video. The next slide just talks about some more severe sensory issues. In noisy environments, I am not able to hear because of all the background noise. Cannot hear. And I also cannot follow very rapid chit-chat conversations where people get very social, chit-chatting back and forth very rapidly. I get bored with that. And there's questions coming up about masking. Some of that stuff's just too hard for me to do. But you can always do some business social. Shake hands with people. There are some individuals that need breaks, but sensory problems are real. Let's go on to the next slide. The next slide talks about this environmental enrichment program, where you use inexpensive, cheap things to stimulate two senses at the same time. You're always changing the things that you stimulate, and it's an adjunct or an add-on to other types of therapy. Now, the next slide shows some really wonderful books for that have been written by non-speaking autistics. Now, I really like How Can I Talk My Lips Don't Move by Tito. I had a chance to meet Tito, and he came into a library, and he was flapping and everything. And I wanted to see, I tested him with a really, really strange picture that he had never seen before, and it had an astronaut in a spacesuit riding a horse out in the desert. And I showed that to Tito, and he types really fast, Apollo 11 on a horse. Another good book's Carly Fleischman's, Arthur Fleischman's Carly's Voice. Then you've got The Reason I Jump, the sequel to The Reason I Jump. I like the sequel. It's a better book. But I'll give you a little tip about the typing. Remember the problem with attention shift. Okay, like on this desktop, my keyboard's way down here. But when I type, that print appears way up here on the screen here, and the keyboard's down below where the video is. Now, many people with autism cannot make that attention shift. And that's the reason why you want to use a tablet, because the virtual keyboard, with using that virtual keyboard, the writing appears right next to the top of the keyboard. Or you're going to have to, on a laptop, put the keyboard on a box, and you need to make sure it's a monitor that does not flicker. This is really, really important. Next slide just shows some brain scans. And the point I want to get across right there, different parts of the brain get turned on when you do different things, like seeing things, hearing words, thinking about things. And where there's a problem in autism is in kind of the inter-office communications. And what you tend to get is uneven skills. Like I'm really good at art and mechanical stuff. Somebody else might be really good at mathematical stuff. And we'll just show some more pretty brain scans. Next slide shows, oh, that's my skull. Let's show the next slide. That's the microbiome. You see the little tiny hairs there. Those are axon tails, and they form great big inter-office communication cables between different parts of the brain. And then I can show you a slide without my ugly skull. And that the connectome is much prettier when it's by itself. The next slide shows the circuit in the brain for speak what you see. Now there's the normal control right there, and I'll show you mine. The next slide. That's my speak what you see. And I have all these extra branches for visual thinking, but I have less fibers for speech. So that might explain why I had trouble getting my speech out. But when I had speech therapy, it increases the bandwidth on the fibers that are still left. And the next slide just shows that. But this is where the therapy made a difference, because I had trouble getting my speech out. Let's go to the next slide. Now, for speak what I hear, I am definitely not an auditory person. I am definitely a visual person. And we'll go on to the next slide. And I want to talk about the importance of developing strengths. That's an artwork I did when I was about 6 or 7 years old. Mother always encouraged my ability in art. It's a picture of a wooden dock or deck that was by the beach. And she always encouraged my my art. And the next slide just shows a picture a young child did in 3-dimensional. Most little kids don't do that. And I would just draw the same horse's head over and over and over again. So mother would broaden my skill. Let's draw the stable. Let's draw the saddle. Or if you have a child that likes cars, let's read about cars, do math with cars, draw pictures of different cars. In other words, broaden that fixation. Broaden the fixation, especially if it's something like cars that can turn into a career. The next slide just talks about the art ability being encouraged. Often we'll have uneven skills, really good at art. I was actually terrible at mathematics, but then you're going to have another autistic person that's good at math. And we'll go to the next slide where it shows that the way I think, it's videos in my head or movies in my head. I'm what's called an object visualizer. And in my new book, Visual Thinking, The Hidden Gifts of People Who Think in Pictures, Patterns, and Abstractions, I discuss 3 different kinds of thinking that you can have in autism. Most people are mixtures of the different kinds of thinking. But in autism, you might get an extreme object visualizer. That's me. And the HBO movie shows how I think. My kind of mind's good at art, mechanical things, photography, working with animals, absolutely terrible in mathematics. And then you have the next kind of mind is the visual, spatial, mathematical mind. And the mathematical mind thinks in patterns. And then you have people that think in words. And it's important to kind of know how the child thinks. That just shows eclipse shadows where the eclipse, the trees made little tiny eclipses like a pinhole camera. That happened on our campus. I noticed detail. I watched a whole bunch of students just walk over that. They just didn't notice it. But I noticed visual detail. The next slide shows 2 things that can bother cattle, like seeing a car through the fence, seeing a piece of red string, seeing a bottle there that might move. Little things that people don't notice. Also in autism, there is there's some better ability to pitch discrimination. There's been a lot of research that shows that these sensory things really, really are real. And the next slide shows one of my cattle handling facilities. And how did I sell my work? One of the things I did to sell my work was to show off pictures of things I had designed. And one thing I really liked in the HBO movie is that it showed my actual projects. It also shows how I think in pictures. It's very, very accurate on that. And I can say that the geek side of me really liked that. The next slide shows a recreation of one of my projects in the HBO movie. I thought that was just so cool. I really, really liked that. The next slide shows starting on my very first project. Now, I had some good mentors in the construction industry. On my first project, the Swift plant in 1974, I criticized some welding and I said it looked like a bird had poo-pooed on it. And that was pretty rude. And the plant engineer pulled me into his office in private and said I had to apologize for that rude kind of talk. He told me what I should do. And then another person that helped me was a small contractor, steel and concrete work contractor, who had seen my drawings and seeked me out. And for 10 years, we built projects together. And so those are on a construction site, some of my early projects. And some of the most fun stuff I ever did was working in construction. And I worked with a lot of people that were probably dyslexic, ADHD, or autistic. Some of these people owned big companies where they made mechanical equipment. They had lots of patents. I really put the emphasis on the career. This is what's made life happy for me, is having a fulfilling career. The next slides just show some of my drawings. And when I showed people my drawings, they were impressed. That's how I sold jobs. Okay, let's work on what are we going to do about job interviews? Well, a job interview for me was lay the drawings on the table and show off the drawings. That's what I did. And they'd look at my drawings and go, wow. In fact, actually today, now that everything's computerized drawings, I'm seeing some very bad drawings. And now the next drawing shows a dipping vat system. And you can see on the concrete work, I have all the reinforcing rods drawn in there. 4 years ago, I got a really horrible set of drawings that the engineering firm had done on a computer, and they hadn't drawn in the reinforcing rods. I marked them all in pencil, and I said, you go back to that engineering firm and get it done right. This is a piece of equipment I developed for the meat industry called the center track restrainer system. You can see a lot of complicated steel work there. And one of the people I worked on this was autistic, undiagnosed. Special ed department builds the stuff. And we need these skills. We need to find back doors into jobs, where you just kind of bypass the interview and get jobs. Well, a friend that has a store and maybe they'd be willing to work with the kid. I think I'm going to stop there. You can have the rest of the slides because I'd like to do questions. And I've already talked about some of the most important stuff, but what you see right there is high-end skilled trades. And I was very interested. I went to the Steve Jobs Theater right before COVID shut everything down. And the glass walls came from Italy and Germany. And the carbon fiber roof came from Dubai. That's very, very high-end skilled trades. That's something to be proud of. All right, let's get some questions going right now. Hope I'm going to get some questions. Hello?
Hello?
Yes, let's get some questions.
Yeah, just a second.
Hi, my name is Sona. I have a son. He is nearly 8 years old. And I always have this question because I'm a big fan of you and I know you know a lot about autism and animal behavior. So I wanted to ask, what's the connection between visual sensory preference as my cats and my son? They both like similar toys and they have similar visual preference. Is there any link?
Does your son speak?
He is speaking, but he is not like having any big vocabulary. So he has very short vocabulary and has sensory issues.
Does he have a decent way to communicate? Even something out like one of these computerized things that will speak, or a picture board or something for him to communicate with?
No, we never use like visual pictures like PECs. We never use those. So we encouraging him to use more spontaneous speech, and you know, the speech therapist, the ABA therapist, all of them, what they recommend, we follow that.
Well, if he can learn to speak, then you don't need to use PECs. But
Yeah.
if you have a child that has like 3-word vocabulary, and he's 8 years old, we need to give him another way to communicate more easily. And that, I can remember the frustration when I couldn't communicate. And I remember that, I showed you that picture of the bicycle in the suitcase. And it was so frustrating when the teacher didn't give me time to explain that in our house suitcases were bags. And I didn't understand the concept of the letter B, the sound of the letter B. But there's a point where they need to get a better way to communicate.
Yeah,
some kids can use sign language, some kids there's various programs you can get for tablets.
Yeah, the thing is, he started talking just before he gets 6, so it's really delayed. So that's why.
But is he starting to talk? Are you getting more and more language?
Yes, and more clarity. Like, it takes time, like it's a step by step, but we had him from severe autism. Now he is in between low and moderate autism.
Okay,
so
well,
in the
that's
spectrum.
good. If you're getting progress, parents always ask me about different programs. I said the most important thing is you're getting progress.
Yes,
now, if you're getting progress right now, then you're doing the right thing.
Yes, the only problem I'm struggling is his memory and his sensory problems. That kind of restrict him to learn more and focus on tasks and academics. And he's better in maths. As you said, there are a few types of visual learners. He is more into maths and numbers rather than alphabets and reading.
You see, because I said there's a visual kind of autism. That's me.
Yeah.
But there's also a mathematical. There are kids that are very mathematical.
He's visual in maths, but he's not very visual in, he's not into reading that much, but he's better in maths, like counting and numbers. He's really good with numbers.
That's good. Then you maybe you can move him ahead in numbers. How is he at things like getting dressed, bathing, these kinds of things?
He is very independent. Wherever I taught him, is very independent.
Good. That's good, learning those skills.
Yeah, he is even better than my other children, like neurotypical ones. So he is more independent than them, and he understands routine better than them. The only problem I have, I can't find his special skill. He really likes music, and he is very athletic. He does parkour, he does swimming, he does cycling.
Well, good. He's very athletic. That's good. And see, the problem you got with autism is it's such a wide spectrum now. Let's say you take a diagnosis like dyslexia. Okay, that's problems of reading. Or ADHD, you tend to, detention. It's a much narrower diagnosis, and this is the problem we've got. We've probably got half of autistic kids that have a special skill, and there's going to be some that don't really have a special skill.
Yeah, he has autism, ADHD, and dyslexia, all three, and Erlin syndrome.
Well, the Erlin syndrome, have you tried the Erlin classes?
Yes, I myself, I qualified as well. I just took the course so I can keep checking on him. Yeah, we got the glasses.
Well, the other thing I find that works also for people that have Erlin syndrome, I talked about the colored paper.
Yeah, we do use.
Yeah,
we do use. All of his notebooks are turquoise.
Well, like I've got a tan shirt on right now, and that would be one of the colors, the light tan like this shirt. Some people like that, and then other people, they like this light blue that's on my children's project book.
Yeah, that light blue, that's the thing for him,
light blue,
calms
like
him.
my tie.
Yes, it calms him.
It needs to be the pale colors.
Yeah.
Not dark blue, light blue.
Yeah, I changed those, but he still have visual sensory problems. So is there any connection?
Now, what about sound sensitivity?
Sound sensitivity he has, but I kind of always give him that opportunity. Like you said, he's in charge of hair dryer.
Okay.
He's in charge of hand dryer. You know, when we go to cinema,
Yes.
at the beginning he was very hesitated, but then he got used to. Now he is properly sitting like other children. So I kind of make him to be prone to that, and he's used
Well,
to it.
that's good that you see it, and making him, see when the child turns the hairdryer on and off, or the vacuum on and off, where they control it,
Yes.
that to desensitize some of that.
Yeah, but still I'm struggling with his memory and his visual sensory. Like my cat and him, they prefer the same toy. You know what I mean? Like he will kind of keep doing with that, playing with that toy, even though he has 1,000 other toys. But
And
his
how
preference.
is it taking turns at a game?
He was not good. He was having meltdowns. He would get angry. But I kind of desensitized him with that as well, like on the cues of airport, like slowly by rewarding him using ABA techniques. And,
Well, and you don't have a surprise at the airport. You know, like you can watch videos and I found that one of the things that I got afraid of them, if I made them interesting.
yeah, exactly. That sports.
What one parent did about the hand dryers in the bathrooms, they went to the websites of all the manufacturers of the hand dryers, and then they got interested in how they worked, and they collected all the websites of hand dryer manufacturers. No, seriously, this actually helped.
Yeah, it's the same with him. Wherever we start with, like even food diet, we started with him. At the beginning, he didn't like. Now he loves healthy, you know, clean food. He wouldn't eat rice. Before he was addicted to all these carbs, rice.
Oh yeah, it's bad.
Now he
And
wouldn't eat.
I get worried that some of these kids with these restrictive diets are going to get the old vitamin deficiency diseases. There was a horrible case where a kid got scurvy, which
Yeah.
is vitamin C deficiency, because
Yeah.
the diet was so restricted. Maybe we need to get somebody else to ask a question. I want to give somebody else a turn.
Yeah, sure. Thank you.
Hi, good morning and nice to meet you. You made a point about people who don't speak much, they're more on touching and smelling things. And I just wanted to know how can that be helped and how can they be helped to speak better?
Well, if you read, I really recommend that you read Tito's book. How Can I Talk If My Lips Don't Move? And it is available in an electronic book. I checked Amazon recently, it is available. And he talks about vision being scrambled. Also, the Japanese boy in the sequel, which I think is a better book, he talks about being like a broken robot and having problems with controlling his movements. And if you have an older child or an adult that's either non-speaking or very poor speaking, I really recommend these books because it gives the inside view of their issues. And I don't have scrambled vision. I see just fine. You see, this is where autism has all these variations. But some of them get scrambled vision, and then smell and touch actually work. Those senses are giving accurate information, so then they tend to use them since they work.
So the wish,
I really recommend, really recommend those books. I've got a PDF here. I'll just hold up that slide again of those books right there. If you have an older kid or an adult that doesn't speak, those books are going to give you so much insight. They type independently. Nobody's holding their wrist or their arm. They type completely independently, and they describe sensory scrambling. Now, I don't have this. I have sound sensitive. And then there's some, I had a student that had the problem with print jingling on the page. But see, this is where the sensory stuff is so variable. This is sensory problems a lot worse than mine is.
Good morning. My question is how to teach taking turns. There is a child, 8-year-old, he struggles with taking turns. He can't wait. And while playing...
That was the reason why when I was 3, we spent a big part of my therapy was learning how to wait and take turns in games.
How do I teach? How do I do it? Like sometimes there's a video activity happening, and there are 3 kids. One after another, they can watch their favorite video clip for maybe 5 minutes. But he can't wait for others.
Well, let's do something where it's shorter than 5 minutes, like a board game. We played a lot of Parcheesi, which is a very simple board game where you shake little cups with dice in it, and you move little wooden pieces around on the board. And I remember grabbing that cup, and Mother said, "You got to wait for your sister to take her turn." And something where it's not 5 minutes. Let's do some turn-taking thing where it's, you know,
1
like
minute.
you take a turn in Parcheesi takes 10 seconds.
Okay, so I start with 10 seconds. The first activity should be very short.
Well, but the thing is, my speech teacher that I had years ago, this would be like in 1950,
Okay.
she just knew that teaching the kids how to wait and take turns was super important. My therapy had a lot of emphasis on that.
All right.
How to wait in line. Okay, you're at the supermarket and you've got to wait in line. You can't cut to the front of the line. That's also turn taking.
The child is able to wait in queue, but only taking turns when there's a person who is talking to him. He finds it difficult. In queue, nobody is speaking to each other. They are facing the other way, so he finds it very easy to wait in queue. But he has...
Okay, take wait queues, okay.
But when he has to play with other children or he has to watch a video and wait for that time, he feels that he's not given his... he's not having control on his activity. I don't know what is the exact feeling he has.
Well, you might try different things. When we were kids, we did a lot of relay races where you'd take turns running and kicking a ball or something like that.
Yeah.
You know, try some different things that involve taking turns. Now, if you're watching videos, one thing I'd recommend is the phone be physically passed.
All right.
The phone has to be physically passed around.
Thank you so much.
The taking turns means the phone has to be given to the other person and passed around if you're doing something on a phone.
All right.
I think that's going to help on the taking turns.
Thank you so much.
Okay, well, maybe we can get another question.
Hi, Doctor. Nice to meet you today. In the last 5 years, we're hearing somebody tell autism causes by TV. I want today listen in your opinion.
Caused by what? I didn't hear you.
TV. Television. TV.
Autism is caused by television?
Yeah, somebody tell that.
No, autism is not caused by television. But if you let a child spend 10 hours a day watching television, that's bad. And it'll probably make the autism worse. You know, we need to be getting them out and doing things. No, but television does not cause autism.
Thank you.
Nice to meet you. I'm Eleonora. I want to ask you, what do you think about the connection between language and motor coordination? Is it important to improve motor coordination in autistic children, to improve also language? What do you think?
Well, there's some really interesting things that's happening with horseback riding. And I've had parents tell me that their kid did their first words on a horse. Now, there's 3 things that happen on a horse. First of all, riding horses is really fun. Yeah. But the other thing is you have to balance and rhythm. You're doing balancing and rhythm at the same time. Now, occupational therapists and sensory integration might get you on a swing and do some of the same thing. But when you stimulate the vestibular system with balance and rhythm, that can be real helpful. Another simple thing that might work is you nail a board to the floor, and then you have the person walk, what I call walk the tightrope like this, along a board that's nailed to the floor. I mean, it's only like that far above the floor. But you do these activities that stimulate the cerebellum.
Yeah.
Things like swinging. There's a paper I worked on years ago with Lorna King, and the child, they had him on a swing and they were working on speech. And there's some good things with the motor and speech. And the thing that's not known is which kids respond to this. You see, this is the problem with any of these sensory things. You know, it works on one kid and another kid it doesn't work. Okay, I worked on my squeeze machine. Some kids respond to deep pressure, other kids don't. This is where the sensory problems are real variable. But some individuals, they do swinging, balancing, rhythmic activities. That can help on speech for some individuals.
Okay. We can use also music, for example,
Yeah.
rhythm.
And
That
the
is very
music can be
important.
helpful. The other thing is there are some individuals that can sing words before they speak them.
Yeah.
Singing is on different brain circuits. So they could sing the words rather than speak them.
And there's-
Sometimes that works.
Thank you. Thank you.
Thank you, Dr. Grandin, for wonderfully sharing your insights as an autistic person. One thing that has caught my eye is that your parent, your mother, played a very key role in
Absolutely. And then another book you might find helpful, I got a book called The Way I See It that's I got a lot of little short articles in it. It's available on Amazon. That might be helpful.
Thank you. Yeah,
I also have a lot of information on website, templegrandin.com. There's templegrandin.com. There's lots of free information on that.
Thank you. So I'm a mother of triplet boys with autism. They are 11 years old, all different. They are all on a different spectrum. And one is still nonverbal. And all my sons are really not academically gifted. And there's one thing you have mentioned, that you're really fortunate and happy that you have a wonderful career. Now, I would like to request if you can share, one word or a direction to us parents. Often we find that we want to follow the typical growth, go to kindergarten, go to primary, go to high school, go to university, get a job, get married, all that. But most of our children with autism don't really seem to fit there. What can you tell us?
The thing, you have uneven skills. I'm a big believer in getting children exposed to lots of different things. I did all kinds of things when I was a child: cooking, sewing, woodworking, art, music. I was taught musical instruments, and I was terrible at musical instruments, but good at art and mechanical things. And so you expose kids to lots of different things, then you can see what they are good at. But I know, like you look at this equipment here, I've worked with people where a single welding class led to building things like what's shown in that picture. And then another kid, it might be mathematics and programming. Some that you have to expose them. And then you've got people with autism that are not going to be building equipment, they're not going to be doing mathematics and programming. Let's say if a kid is good with numbers, well then show him other mathematical stuff. Here's some really cool pattern stuff right here I found in one of my science magazines. With those patterns, they all have mathematics behind them. Isn't that cool? In a science magazine.
Yeah.
There's some kids that are going to just, they may be gifted in that. You see, this is the problem. You're really good at one thing, sometimes really bad at something else. And the people that build the equipment, like you see there, complicated stuff, most of them could not do algebra. It's all pure visual thinking. But they're building stuff like that.
Thank you.
I had a chance to go on a corporate jet the other day. The guy that took one welding class, He builds entire beef plants, and he just has them memorized in his head, a single welding class. He's building entire beef plants.
Unfortunately,
Now,
we're
he's
running.
not autistic. He's not autistic. But I did work with several other people in metalworking that I'm pretty sure were autistic.
We're out of time now, so we're just going to have one more question. I know that we would. One more question.
Hello.
Midnight or whatever, I'm going to go to bed. But I'm really glad that I was able to get up and talk to everybody and free to give the videotape around to people. There's more slides in this deck. You can go ahead and give people the whole slide deck. It just wasn't time to work tonight to show all the slides.
Hello, Dr. Grandin. Thank you so much for the presentation. My question is, right now I'm working as a general practitioner, but when I was a teenager, I had a distant cousin who, at that time, he was 7 years old. He has symptoms of aggressive behavior and at times, but most of the times he's a very quiet kid. He won't interact much and everything, but the aggressive behavior is the key point, like it's almost disruptive. And later on we diagnosed he has autism. But
How old was he when he was doing the destructive behavior?
at 7 years old. And because of that, his whole family also have a history of mental illness, like other mental illness. It's stigmatizing, it's so traumatizing for all of them, especially the boy. So how to deal with autism children with aggressive behavior?
I had aggressive behavior when I was 7. There was a penalty for it. There was no television for one night. For aggressive behavior. The other thing you have to look at, what is bringing it on? Is there a problem with frustration with communication or with sensory overload?
Communication.
We've got to make sure he doesn't have if the child is non-speaking, then you always have to make sure you do not have a hidden painful medical issue, like maybe an ear infection, urinary tract infection, acid reflux in their stomach, a toothache, something that's hurting that they cannot tell you about.
I think he had meningitis. He had meningitis.
I also problems with things like getting aggressive when I was a child was worse when I got tired. I had a pretty good sense of when she needed to just say I need to go to my room and just calm down. But when I was 7, I was fully verbal and there were consequences for aggressive behavior. No TV for one night. And then I threw a big tantrum. Mother would put me in my room and let me calm down for half an hour. And then she'd say, well, you know the rule. You can join the family now. But there'll be no television tonight. And I understood consequences, but I think there's some individuals where they may not make the connection between the tantrum they had at school and no television that night. See, this is the problem you've got with autism. You've got such a big range.
Okay, I think that that was.
And then you've got the autistic. You see, the people that I worked with that had the metalworking shop and all the patents, designing equipment, they would have been more the Asperger type. There would have been no speech delay. You see, this is where that Asperger type with no speech delay now has been merged in with the autism with speech delay. I had speech delay, so I was definitely not the Asperger type. And the people that I worked with professionally in metalworking work would have been the Asperger type. But they had social issues. I'll never forget one of the jobs, I had to drag the guy out of the shop because before he got my the plant engineer.
We're out of time now. Thank you very much. Thank you for joining us.
Thank you.
And it's my honor to introduce Dr. Alok Sharma. Dr. Alok Sharma is the professor and head of the Department of Neurosurgery at LTM Medical College and Hospital in Mumbai, India. He is also the director of Neurogen Brain and Spine Institute and KLS Institute of Anti-Aging, both in Navi, Mumbai. He is the president of the Stem Cell Society in India and vice president of the International Association of Neurorestoratology. He has published 172 scientific papers, authored 24 books, contributed chapters in 19 textbooks, and made over 200 scientific presentations. He is a world-renowned pioneer in the field of cellular therapy for neurological disorders, having treated more than 12,000 patients from 75 different countries. His landmark accomplishments include the publication of the world's first scientific paper on the role of cellular therapy in autism. He has revolutionized the management of neurodevelopmental disorders with his innovative combination of cellular and integrative therapies. For this, he has received several international and national awards, such as the Rose of Paracelsus Award from the EMA Oxford 2016, the European Award for Best Practices, Brussels 2018, the Bharat Gaurav Award, London 2019, the Newton Universal Legendary Award, Boston 2022, the Sino-Phil Asia International Peace Award, Manila 2023, etc. Let's welcome Dr. Alok Sharma.
This is truly amazing to be in Dubai, to be at this wonderful international conference for autism and neurodevelopmental disorders, but most important, to be able to give a talk immediately after Temple Grandin. What an honor. I had never thought in my life that, one day I'd be speaking after the legendary Temple Grandin. Temple, you're just so amazing. You're not you, your life, your thoughts, your work, your effort is not just an inspiration to people on the spectrum, to their families, but to all of us caretakers, researchers, and doctors in the field as well. So I'd like to begin by thanking Temple for the wonderful and amazing talk that she just gave. I'm going to speak on a new topic, that's regenerative medicine in autism spectrum disorders. When I give a talk, I like to begin with this picture. This is a painting, a huge painting, the size of this entire wall, which I found in a hospital in Howlin, Taiwan. And when I entered that hospital, I asked them, why is this picture here? They said, this is a picture of Lord Buddha going into the jungle to heal. And they said the job of the physician is to reach out to people who are in suffering and heal them. So that's what we have to do, reach out and help those in need of healing. Now, if you look at the increasing prevalence of autism, it is actually unbelievable and incredible that the world has not taken notice of what's happening. You look and see in 2004, the incidence was 1 in 166. In 2023, it has become 1 in 36. At this rate, in the next 2 decades, every third child will be on the autism spectrum. Okay, this is something we as medical professionals need to bring to the attention of society, of people, of governments, of administrators and rulers, that this is unprecedented and that the facilities to take care of these children do not match up to the increasing incidence. There are about 70 million kids on the planet. That's 1% of the world's population. It's like a huge percentage of people. So the current situation is that, you have a child who has some symptoms, the parents notice, you go to the doctor, therapist, get a diagnosis, and they say what you can do is therapy, you start the therapy and you're back to where you were. So what's new? What am I going to be talking in this talk that's different? First, the concept of neurodiversity. And this is what Temple spoke of, okay? That we have to see how people on the spectrum are diverse, that they are not less than, they are different, that they have uneven talents and skills. So the concept of neurodiversity, because now there are going to be so many people on the planet that you can't look at them in the way that we've been looking at them earlier. The other exciting thing, and I'm going to highlight that, is a better understanding of what's happening with the brain. And this is what has changed everything. Then the whole concept of neuronal regeneration, that it is possible to regenerate the brain that's not functioning as well. And the concept of multidisciplinary management, and of course the main base of my talk, which is cellular therapy. Now, what is new is that for the first time in medical history, we are now understanding which parts of the brain are functioning differently from neurotypical brains. And we've done scans, we've done a lot of research in this area, and you can see that list: the amygdala, the hippocampus, the parahippocampal gyrus, the cerebellum, the caudate nucleus, the mesial temporal lobes, thalamus, superior and middle temporal poles. So we've actually identified very clearly which parts of the brain are functioning less. We've also identified which parts of the brain are functioning more. Our focus so far has been on what these children can't do. What we also need to look at, which parts of their brain actually are functioning more than what neurotypical people do. And there are actually parts in the calcarine fissure, the Heschel's gyrus, cortical frontal areas that function more. They are hypermetabolic. So we need to understand this as well. And our work has been published in a landmark paper, among the first of it's in published literature in the World Journal of Nuclear Medicine, where we've clearly highlighted which parts of the brain work less and which are working more. Now, what we found here, and this is the only thing that we need to give attention to, because Temple again keeps talking of early intervention. She keeps talking about early intervention, and I'm going to show you the scientific base of the need for early intervention. And that is this. If you look at this graphic, you will see that, you will see that the brain metabolism over the years keeps on declining. So what you see in light green is how the brains of neurotypical kids, the brain metabolism keeps on increasing. Whereas children on the spectrum is the light blue, you can see it keeps on declining. What does this mean? It means the earlier we treat the children, the early intervention is there, the better results, because the later you treat them, the hypermetabolism is actually increased. So the old thinking was that once the brain is damaged, you cannot regenerate it, and the new thinking is it's possible to regenerate the brain through cellular replacement and repair. The other thing that has changed in autism is the concept of multidisciplinary management. So far what would happen is a person specializes in something and then that's all they would offer. So if you're a center that has occupational therapy, you focus on occupational therapy. You have a center that does speech therapy, you focus on that. But what is the need is a multidisciplinary management, which includes everything, all the things listed, and cell therapy, which I will talk about, is one of them. So there is no one silver bullet. The management of autism will be multidisciplinary. So look at that. On the left-hand side, you see a fractured bone. And I ask yourself, will you give rehabilitation to a person with that fractured bone? Would anybody give physiotherapy on a broken bone? Now look at the left. You go to an orthopedic surgeon, you get it fixed, don't you? And now you give rehabilitation. But in autism, we do exactly the opposite. On the left-hand side, the blue area is the hypermetabolic brain. We are giving rehabilitation on a brain that's not functioning optimally, and then we are expecting results of a normal brain. It won't happen. But through cellular therapy, you can see on the right-hand side, the brain has started functioning again. Now, if you give rehabilitation, you are bound to get better results. So cell therapy is a promising new modality where you use healthy cells to replace damaged cells. So that's the brain damage, and you can see that there is recovery. So now look and see what are stem cells. So the word stem comes from the stem of a plant, and just like from the stem of a plant, you can have leaves, fruits, everything else. There are some cells from which all the other cells arise. So the way stem cells work is they multiply, they convert into other cell types, they improve the blood supply, and they release certain positive growth chemicals, and because of that, they repair, they regenerate, and they replace damaged tissue. Cells are of two types. You can be autologous, when you take from the patient, put it back in the patient, or donor cells, when you take it from somebody else. There are different types of cells. You can get them from the embryo, but this is very controversial, so we do not use it. You can get them from the umbilical cord. You can get it from the patient itself, from the bone, and that's what we use. They are called adult stem cells, and induced pluripotent stem cells are in the research stage. So we work with adult stem cells because they are safe, they don't form tumors, they have no rejection, they are easily obtainable, and there are no ethical issues. There are different ways of injecting stem cells. You can inject it intrathecally into the spinal fluid, that's what we do, or intravenously, intramuscularly, through the nose or directly into the brain. How does cellular therapy work? We know the main problem in autism is there is hypoperfusion, decreased oxygenation, and problems with the immune system and inflammation. Cell therapy works through both these mechanisms. So here is a small video showing the 3 basic steps. What we do a bone marrow aspiration with a needle, separate the cells and inject it back. The whole process has only 2 needle pricks. Let's look at a video. There you can see with the needle we are aspirating bone marrow. That takes 15-20 minutes. The bone marrow is put into machines. It separates the cells, and once the cells are ready, with a very thin needle we inject it back. Just 2 needle pricks. And we take cells from the child and put it back into the child. So let's review what the world literature says. So there are a total of 33 clinical studies, published papers, which show a 80% success rate. 33 worldwide papers. And if you see a review of literature, the world's first scientific paper was published from India. It was by us. We also published the 6th one. The others came from China, Italy, America, etc. So this is the world's first paper on cell therapy in autism, which we published in 2014. This was our paper, and it showed 91% of the patients improved. The second paper came from China. Here again, they showed an 88% improvement. The third paper came from the United States by Dawson, again showing 90% improvement. This another paper from the United States by Kimberly et al. Showing 90% success rate. This paper by Martinez from Mexico showing a 95% success rate. This paper from Vietnam by Thang et al. Which showed a 93% success rate. This paper from Italy, which showed a 78% success rate. Now, this is a meta-analysis. This is a review of 460 patients. And at the end, in this paper, they summarize that cellular therapy is safe and that it improves patients with autism spectrum, regardless of what type of cell we use. In this other systemic review by Jiangyang Q from China, they looked at 325 patients. And again, they said it is safe and effective. So there is enough published worldwide literature to show the effectiveness of cellular therapy. Now, this is our latest paper. We had 2 papers, but I'll talk about the second paper because this was 254 patients. We use autologous bone marrow mononuclear cells. You can see the improvement in the various symptoms, and almost all the symptoms, whether it is social interaction, eye contact, attention, stereotypical behavior, aggressiveness, hyperactivity, self-injurious behavior, sitting tolerance, command following, speech, communication, all these you can see above is the percentage of improvement. And we have scales called ICAN CASE, and you can see that there was a significant improvement, 94% and 95% in these scales. Now here's something interesting. The results depended on age. So those kids who were less than 5 years, we had a 97% success rate. Between 5 to 10, it reduced to 94. Between 10 to 15, 94 again. And 15 and above, it was 91. So the earlier we intervene, the better results we are likely to get. Here again, you can see on CARS scale, again, 98, 95, 90, 91. So you can see that age affects the outcome. Now, what was the objective proof? Because one is clinical improvement. So in our study, we actually showed objective improvement. So above, this is a PET CT scan where the blue areas are the hypometabolic areas, the areas that are functioning less than normal. So you can see above all the blue. Now this is done on a Siemens machine. Below, you see 6 months later, and you can see the hypometabolic areas are gone. So this is objective proof. I'm just showing you 1 or 2 scans, but we have almost 3,000 such scans before and after that show that the brain damage, the parts of the brain that are not functioning appropriately in autism, they can be repaired. And this is proof of that. So this is on a Siemens machine, and this is on a GE machine. Again, you can see the cerebellum, blue area, hypometabolic, and below you can see that it has improved. So on 2 different sets of machines, Siemens machine and General Electric machines, both show before and after improvement. We have a total of 6 scientific publications in the results of cell therapy in autism. And now international books Medical books are introducing chapters. So in this book on recent advances in autism, there's a chapter, Stem Cell Therapy in Autism Spectrum Disorders, and they've asked us to write the chapter. So we've written the chapter for this book. Now this is data, what I showed you earlier was published. This data of 1,000 patients has been sent for publication. But just to give you an outcome, this is 1,010 patients. And again, you can see more or less similar symptomatic improvements. Again, the ICAN Cache scales, good improvement. Individual domains of ISA. And age-wise, again, you can see the same thing. Below 5 years, 89% improvement. Above 15 years, it dropped to 80%. And this is the analysis. You can see above the blue areas, the damaged areas, and below, after cell therapy, you can see that the brain has got activated. You can again see above and below. So complications. So we've had no major complications. There has been no neurological deterioration, no infection. However, one major concern is that 3% of our patients develop increased incidence of epilepsy when they already had epilepsy in the past. 10% of the patients get a spinal headache which lasts for 1 or 2 days immediately after the procedure, and there was some nausea, vomiting, local pain, etc. Now we've published this as a separate paper. People normally like to hide their adverse events. We've published a paper saying that seizures may happen as an adverse event because there is no treatment which does not have adverse events. But if you know it, you can actually manage it. So we've published this as well. Now I'll just show you a couple of videos. Just if you have little time, so yeah, we have some time. So I'll show you a couple of videos. There are three sets of patients from 3 continents. This is a child from America. Father was a cardiologist, mother is a nurse, and he's improved so much. Today, this kid is not only completely off the spectrum, this video is a little old, but he's topping in school and he's doing wonderfully well.
I couldn't get him to engage with me. I couldn't get him to give me eye contact. Over time, he started to lose a lot of vocabulary. Right around 18 months to the age of 2 years, he just slid backwards.
He would flap like that, and he would walk on his tiptoes, look at the wall and be talking to the wall. He had problems with eye contact. He'd never look you straight in the eye. He had problems with his speech. Some research and found out about neurogen. And the big question that I had in my own mind was, what is there to lose? And I could not come up with a good answer, and I said, we have to do it.
We started seeing better eye contact, definitely a difference in his engagement with us, with his sibling, his mood. He was so much calmer. Now he's all about taking his own shower. I have to just prompt him to get out, but he'll wash himself and he'll put his clothes on. Saw the PET scan images. I can't tell you the word, we were just so excited and thrilled. The areas that were hypoactive or non-active were warm. There was activity there. Ganesh has gone from the 3rd grade, 4th month reading level to a 7th grade, 1st month reading level in 5 months.
And now we have Mercy over here.
We went to different doctors, we went to different hospitals, and when I brought it up, they were like, oh, no, don't worry, it's because they are boys, they are triplets, they were premature. I would be walking out and I'm like, bye, and no child is crying, no child is waving back bye. And by then, for sure, I knew that they should be doing that. The children had this behavior of disappearing. In fact, Eric disappeared 3 times in the middle of the night. The biting, the spitting, the scratching. How are we going to stop this behavior? We went to see the neurologist, and in 5 minutes, he said, these children are autistic.
As parents, it was very traumatizing. First of all, we didn't understand what
autistic means.
So I decided to really get to read a lot about autism. I remember the first time I read about stem cell. I was like, wow, this is really good.
We had a lot of questions which we asked, and we got very clear answers from Dr. Sharma.
The day of the stem cell itself came, actually I was a bit anxious, of course, but really I didn't have fear. A bit of apprehension, anxiety, of course, as a mother, but I knew they're in good hands.
We put a needle in this pelvic bone and then we take out the bone marrow, which is the fluid inside the bone. The pure stem cells, once they are ready, a thin needle is inserted into the lower back. We inject the stem cells into the cerebrospinal fluid. It flows all the way up to the brain.
Things that would have taken probably years to be accomplished in my sons, in like 8 months' time, we've really been able to come very far. Just with water.
They used to defecate on their clothes, but now they can use the toilet. We've seen a lot of improvement in terms of spitting. The tantrums have reduced. Sleeping used to be a problem before, but at the moment, he's taken to his bed. It takes a few minutes and he's asleep.
See my son's cycle. You try to make them understand what it is to pedal, and they couldn't.
But after stem cell, when we arrived in Kenya the following day and we went out,
and these guys could cycle.
I'm going to send you to buy tomato paste, okay? I'm going to send you to buy what?
Tomato paste.
In the shop. Where is the shop?
It's here.
Okay. So I'm going to give you...
Money.
For what?
Buy tomato lollipop. I'm going to wear my shoes. That's right.
Parents ask me, so do you really think stem cell works? And I'm like, I can see changes, I can touch, I can feel, I can smell. Of course, for me, stem cell works. I'll do it until my children get well.
So that's 2 stories. And by the way, Ricky's right here. You're going to see him. He's right here. We are short of time, so I won't talk much about cerebral palsy, but this is a paper. It works just as well in cerebral palsy. We've got 15 articles, chapters in textbooks. And that's the brain damage before in cerebral palsy. That's after. You can see the improvement. Then in intellectual disability, it works as well. We have the world's first scientific paper. We've treated more than 12,000 patients from 75 countries, total of 106 papers and 16 books. And I'd just like to share the views of our Honorable Prime Minister.
मैं जापान गया, तो जापान मेरे कार्यक्रम में मैंने एक कार्यक्रम क्या जोड़ा? मैं वहाँ एक नोबेल लॉरिएट साइंटिस्ट याकामाहा को मिलने गया। मैं इसलिए किया गया कि उन्होंने स्टेम सेल के अंदर जो रिसर्च की है, मैंने जितना पढ़ा था तो मेरे मन में आया था शायद इनकी एक खोज हमारे काम आ सकती है क्या है। हम गए तो वहाँ गए, उनसे चर्चा की और बेंगलोर के हमारे साइंस इंस्टीट्यूट के साथ आज उस दिशा में हमारा काम हो रहा है कि स्टेम सेल्स के द्वारा हमारे युवा साइंटिस्ट कुछ खोज करें।
So that is the Prime Minister of India, Shri Narendra Modi ji, talking in Parliament about stem cells. And here is the President of the United States.
Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research. Scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate a severed spinal cord and lift someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. There's no finish line in the work of science. The race is always with us. The urgent work of giving substance to hope and answering those many bedside prayers, of seeking a day when words like terminal and incurable are potentially retired from our vocabulary.
So my conclusion is that adult stem cell therapy that we use may be considered a safe and effective treatment option for autism, cerebral palsy, and intellectual disability. It accelerates development, reduces disability, helps in functional recovery, and improves the quality of his life. We heard the two biggest democracies in the world are India and America. You heard the Prime Minister of India speak of stem cells. You heard the President of America speak about stem cells. But now I want you to hear somebody more important than that. The child you saw in that video, he's right here, Ricky. Ricky, say a few words. Talk to the audience.
Thank you.
Say something.
Thank you, everyone. I like to say thank you for giving me the neurogen stuff which we made.
This child could not speak. This child could not go to school. Today he's standing in front of you and giving a speech. Let's give him a big hand.
Thank you.
Now, it's a true honor to call Dr. Nadia Al-Saig on stage. She's our chief guest. Please, all of you all, a big round of applause for ma'am. She's the founder and director general of Senses Residential and Daycare for Special Needs. We would really like to felicitate ma'am, as Senses has been the strategic partner for ICAN. Next, we would social media. Yeah. We'll just do a bit of that. Next, we would like to felicitate MENA organization as well, as they as well are the strategic partners for ICAN. A big round of applause. Thank you so much. And now we would like to felicitate Farhan Shahid, who is from Senses and has been helping us with the entire organization of ICAN. So thanks to one and all for helping us putting this show up. Okay, now I would like to invite Dr. Nadia to say a few words.
بسم الله الرحمن الرحيم والصلاة والسلام على خير الأنام محمد المصطفى وعلى آله وصحبه أجمعين. Good morning everyone, and I would like to welcome the International Conference for Autism and Neurodevelopmental Disorder ICAN Dubai 2023. It's a great honor to be a part of this event, and hope we come down with this conference with the best practice to the region and share knowledge to the latest trends on autism and neurodevelopmental disorder. And really, I would like to take the opportunity to thank you all, thank the speakers and the partners of this conference, and especially the audience for your participation. Thank you so much. Thank you.
So now we will be inaugurating our book, Treatments for Autism. As we did see in the film, it was earlier already inaugurated in English, but now we are inaugurating it in Arabic language. So ma'am would do the honors. Just to give you a brief about this book has all the therapies, treatments, all the information about autism and all kinds of newer age treatments as well in the book. You can have a copy online on our website. You can request for that, as well as we have English books that are available. So you can just send us an email on our website. Just log on to www.autismconnect.com. and you can just subscribe for the book and you will be able to get one. Thank you so much, everyone. I would really be very thankful to all of you. Thank you so much.